The story of Malaria. Malaria is an infection caused by the Plasmodium parasite that can be spread by mosquitoes, and when it enters into our body, it will affect mostly in the liver and red blood cells. There are 4 species of parasite that cause malaria in humans, which are P. falciparum, P. vivax, P. ovale, and P. malariae. When the mosquito bites you, the sporozoite gets into your blood system. The sporozoite get into the liver where they replicate and form into merozoite. The merozoite continue replicating themselves, causing the liver cell to explode. Then the free merozoite will catch the hemoglobin and go into 2 cycles. First is a sexual cycle, where the merozoite dividing more of themselves and made the red blood cell to explode. After that, they will continue attaching to the new red blood cell. Some merozoites will develop into gametocytes in sexual cycle, which will be transmitted back to the mosquitoes and start the cycle over again. Specific immune responses are required to control the infection at multiple positions of the parasite life cycle. Before the merozoite gets into the liver, antibodies will do the work as an immune system. But if it already entered into our liver, T cells will do the work instead. Antibodies also do the same work by preventing the merozoite from the red blood cells. But if it's still not enough, they will remove the merozoite by phagocytosis. Malaria has been noted for more than 4,000 years. In prehistory, malaria are found in Africa and was thought to be from gorillas. Next, in Middle Ages, anti-malarial artemisinin was described. In 1880, Charles Servan discovered the malaria parasite. Next, in 1897, Ronald Ross discovered the transmission of malaria parasite by mosquitoes. During 19th century, there are many studies about malaria parasite and drug. At the same time, DDT insecticide was invented. In 1970 to 1990, the overuse of DDT leads to DDT-resistant mosquitoes. In 1990 to 20th century, artemisinin are promoted by the World Health Organization. And now, in 2016, ACT is considered to be the first-line treatment in 80 countries around the world. Malaria is mostly found in tropical and subtropical countries. There are 6 main regions that are rich to malaria: Central America, South America, Africa, Middle East, Asia, and Southeast Asia. In 2016, there are 126 million new cases of malaria, and there are about 445,000 people died of malaria. P. falciparum is the most harmful type of malaria. It is very common in countries in Africa south of the Sahara Desert, and people exposed to them are most at risk of dying from malaria. People who have little or no immunity to malaria, such as young children, pregnant women, or travelers coming from areas with no malaria, are more likely to become very sick and die. However, poor people living in rural areas who lack access to health care are at greater risk for this disease. The parasite is found in red blood cells of an infected person. It can be transmitted through blood transfusion, organ transplant, or the shared use of needles or syringes contaminated with blood. Malaria can also be transmitted from mother to her unborn infant, known as congenital malaria. The incubation period of the parasite to the appearance of the symptom vary according to the type of the parasite that infects an individual. For the first one, Plasmodium malariae ranges from about 18 to 40 days. Plasmodium vivax and Plasmodium ovale ranges from 12 to 18 days. For the last one, P. falciparum ranges from 9 to 14 days. Once the symptoms appear, the patient undergoes the periodic cold-hot sweating cycle. Cold stage lasts about 15 to 60 minutes and the symptoms are feeling cold and shivering. Hot stage lasts about 2 to 6 hours and the symptoms consist of high fever and additional of headache, nausea, and vomiting. Sweating stage lasts about 2 to 4 hours where the fever drops rapidly and the patients sweat profusely over. How to treat a patient with malaria depends on the type of the infecting parasite, the area where the disease was acquired, and its drug resistance status. The last one is the clinical status of the patient. Malaria should be treated as fast as possible before it becomes serious and life-threatening. Several good anti-malaria drugs are available and should be taken early on. Most drugs used in treatment are active against the parasite found in the blood. For example, artemisinin that kills the parasite by binding with proteins in many of the organism's key biochemical pathways, and chloroquine works by interfering with the growth of parasites in the red blood cells of the human body.